Disease overview. Signs and symptoms. Chronic granulomatous disease is characterized by a susceptibility to repeated bacterial and fungal infections. CGD can also be associated with the development of granulomatous lesions of the skin, lungs, bones and lymph nodes formed by collections of inflammatory white blood cells. There is usually a history of repeated infections, including inflammation of the lymph glands, suppurative lymphadenitis, skin infections and pneumonia. Gastrointestinal problems can also occur, including diarrhea, abdominal pain, colitis and perianal abscesses, infection of the bones, osteomyelitis, brain abscesses, obstruction of the genitourinary tract and/or gastrointestinal tract due to the formation of granulomatous tissue and delayed growth are also symptomatic of chronic granulomatous disease. Abnormal enlargement of the liver and spleen, hepatosplenomegaly, may also occur. Causes. Chronic granulomatous disease is a genetic disease. Changes, variants or mutations in any one of 5 different genes can cause a defect in an enzyme called phagocyte NADPH oxidase. Affected populations. Chronic granulomatous disease affects males more often than females. In a few cases, the first symptoms have been known to occur in adulthood. Disorders with similar symptoms. Granulomatosis with polyangiitis is an uncommon collagen vascular disorder, also referred to as connective tissue disorder, affecting the blood vessels. Initial symptoms usually appear as a severe cold progressing to sinusitis, ulcerations of the mucous membranes in the nose with secondary bacterial infection, middle ear infection, otitis media, cough, expectoration of blood, hemoptysis, and pleuritis. Sarcoidosis is a multi-system disorder that most often affects individuals between 20 and 40 years of age. The granulomas that are formed are thought to alter the normal structure of and, potentially, the normal functions of the affected organ, causing symptoms in individuals with sarcoidosis. Such granuloma formation most commonly affects the lungs. Churg-Strauss syndrome is a rare disorder that may affect multiple organ systems, particularly the lungs. In addition, asthma and other associated lung pulmonary abnormalities, i.e., pulmonary infiltrates, often precede the development of the generalized systemic symptoms and findings seen in Churg-Strauss syndrome by 1 or more years. Diagnosis. A diagnosis of chronic granulomatous disease is made based upon a thorough clinical evaluation, a detailed patient history, and specialized procedures to measure oxidant production by white blood cells. If CGD is diagnosed based on defects in blood cell oxidant production, genetic testing is typically recommended to determine the specific type of CGD. Treatment. The orphan drug interferon gamma-1b, Actimmune, has been approved by the U.S. Food and Drug Administration, FDA, for the treatment of chronic granulomatous disease. Genetic counseling is recommended for affected individuals and their families. Other treatment is symptomatic and supportive. Thank you for watching. Please subscribe for more videos. Your like, comment, and share always motivate us.